During my second clinical rotation, I learned a lot, and honestly, more than I thought I would. Since I already work in an outpatient facility, I didn't really expect anything different, and I was actually proven wrong. I learned that every clinical location or just any outpatient facility, it has its different aspects, and you can't expect every facility to be the same. The one thing that this clinical taught me was responsibility and being responsible for the patients that I am treating. During my first clinical rotation, I would always rely on my CI, and I was always very reluctant to step in and treat patients. And if somebody had a question, I would automatically send them off to talk to my CI or the supervising PT. And obviously, if it was a very urgent question, something that I couldn't answer, I would tell them to go speak to the PT, or I would just go get them and have them talk to them. But if it was something that I could answer, I would always try to help them and take responsibility for that patient. I learned a lot of new skills during this clinical rotation, and some of these skills were confidence in treating patients. I wasn't as shy talking to people, and I felt confident in showing them exercises that were on their flow chart and just walking them through their treatment session. I also learned a lot of new skills. When we would treat knee replacement patients, a lot of them struggled with getting that flexion range of motion, and my CI would utilize the muscle trigger gun, which would help relax the quad muscle and help progress them with their range of motion. With the skills that I learned at this clinical, I will be able to apply them to any future job that I will have. They will be a valuable tool for me, and I will be able to contribute these skills to the team that I will be working with, and I am very grateful for that. As far as continuing education goes, the only thing that I feel that I need to work on more or take possible continuing education courses would be in Mackenzie. During this clinical, we had a lot of low back patients, and even though I do feel pretty comfortable with instructing patients how to do the Mackenzie method and walking them through their exercises, but I feel that taking a continuing education course in that would really benefit me. Another continuing education course that I would really want to take in the future would be wound care. And I know that is something that I would possibly be utilizing if I was working in a hospital setting, but that is definitely something I am interested in the future. And this clinical rotation really has taught me a lot, and I am very grateful that I was able to experience it, and the skills that I learned will be valuable in any setting that I will be working in.